Y'all, there's plenty of seats right over here if y'all want to come up and sit down. Good morning and welcome. So happy you're here today. Still, we have a couple of seats. Please come up and join the festivities. General Griffin, honored guest, my name's Tucker Martin, and it's a pleasure to welcome you here today as we launch Arkansas Mobile Opioid Recovery. There are no overnight solutions when it comes to the opioid crisis in this state. I wish there were. I think we all do. But there are practical solutions. How do you find those practical solutions? The answer to that is pretty simple. You just ask questions. And for a few years now, Dr. Martin's team at River Valley Medical Wellness has been asking questions of our patients. What are the biggest obstacles that you face when trying to access care for opioid use disorder, addiction in common terms? And over and over and over again, we hear the same thing repeated: transportation, transportation, transportation. Transportation is a huge obstacle when you're trapped in the cycle of active addiction. It's hard to get across town, and it's certainly difficult to travel from one town to another to find care. So our practical solution to that scenario is to bring high-quality, evidence-based treatment and recovery solutions directly to communities that need those resources the most. Hence, the Armor Mobile Health Clinic. As we endeavor to serve the underserved, it's our promise and commitment to do it with kindness, compassion, and dignity, with evidence-based practices. And I wanted to take a moment and introduce you to the team that is going to be providing that direct care. This is Sakina Shaw. She's a psychiatric nurse practitioner. Tanya Sowers is a family practice nurse practitioner with years of experience in providing medication-assisted treatment services. Dr. Martin will explain a little bit more about what that is. Russell Boyd is a peer recovery support specialist, and I wanted to mention that just last Thursday, Russell received quite a recognition from the Arkansas Specialty Court Conference. He was named Peer Recovery Support Specialist of the Year, so congratulations, Russell. Stacy Franks is a peer recovery peer supervisor, and Tahara Macklin, another peer recovery support specialist. So the three peers here today are a small portion of a team of 5 peer recovery support specialists. Again, we'll talk more about what those individuals do, but they're essentially people with lived experience that can connect on a one-on-one level with people who need help and help show them that pathway to long-term sustainable recovery. It's important to note that addiction, substance use disorder, opioid use disorder specifically, is a chronic condition that is easily treatable, right? Another chronic condition that I feel like we're all aware of is diabetes, right? And we all know people who are diabetic. And when a diabetic doesn't follow their treatment plan, they don't exercise right, their diet gets off kilter, or whatever the occurrence is, and they have their symptoms come forward, right? That's something that, if they have a diabetic episode, that's something that garners an immense amount of sympathy and compassion from each one of us, right? For people with substance use disorder, that's a chronic condition, again, easily treatable and manageable with the appropriate tools and the guidance of well-credentialed medical providers. But when there's a return to use or the symptoms of that use disorder arise, our natural tendency, unfortunately, is to look at those people with a bit of shame, right? And what our peer recovery support specialists, our medical providers, and the leadership of Dr. Martin, we want to reach those people where they're at and treat them with dignity and respect, because they deserve that. Because they're not bad people trying to become good people. They're very simply sick people who need to get well. So in order to tell you what getting well looks like and the history of Armor, I want to introduce you to Dr. Kristen Martin. She is the CEO and Medical Director of River Valley Medical Wellness. She is the president of the Arkansas Society of Addiction Medicine and an executive board member for the Arkansas Foundation for Medical Care. Beyond that, she's a compassionate medical provider who's been in the addiction medicine space for many years and is an emergency department physician still to this day. So, Dr. Martin, welcome.
Thank you so much, and thank you all so much for coming out today. For those of you who have known me at least 2 years, you probably heard me talk about the necessity for mobile units. A lot of you have listened to me in the emergency rooms, writing grants, doing research, trying to figure out a better solution. And this is a 2-year-long dream that to bring evidence-based treatment and practice and recovery solutions to our rural and vulnerable populations. I have to admit, I live in Little Rock, right? So finding a medical provider in Little Rock isn't but just a hop, skip, and a jump away. But whenever I've worked in emergency rooms in Arkansas over the last 15 years, I've worked in the rural environments, and I can tell you what happens when people don't get care. I can tell you what happens when they don't have access. It gives me goosebumps to even talk about what happens, because part of the reason that we wanted to start here in Malvern is because I work at that hospital just a few miles away. And I know what it looks like whenever somebody doesn't have access to addiction medicine services or recovery in time. And it looks like me having to call a family, having to call a young wife with a new baby to tell them that her husband and that father won't be home. It's me calling a 19-year-old's parents and telling them that was a preventable solution, but we didn't make it there in time. And so after enough of that and working as an emergency room physician, we decided that we wanted to step out and step up into the community. Because you see, by the time you reach us into the emergency room, the crisis has already happened. In America, about every 5 minutes, there's another American that dies from an overdose. Today, on average, there will be 2 Arkansans that die from overdose. What we've been trying to do in all of our old solutions, it's not that they're bad, it's just they're not working, and they're not working well enough. And one of the things I hear from patients all the time is, I come into the emergency room and I talk to them and I say, hey, would you like to have a different way of life? Would you like to hear about some solutions? And there is not a shift that goes by that they do not cry and say, thank you. No one's ever asked me before if I wanted a solution. And to me, that's something as medical providers we need to change. And so our idea for this, when we started a couple years ago, and part of it started because we had some outpatient clinics, but people simply could not reach us. We realized that transportation was the biggest barrier, as they told us that they would love to come in. They might not have access to telemedicine because they have to use their data plans in order to be able to maybe call a family member to get a ride to go to work each day. So some of the different typical solutions don't fit for rural environments. And I'm sorry, but just because you live in a rural area, just because you're in a county that doesn't have a population of over 100,000, it shouldn't mean that you can't get help. Patients they're faced with tough choices between putting gas in their car and going at least 40 miles in order to receive recovery help. Because that's the average. It's over 40 miles if you live in a rural environment to receive specialty care. Even more than that if you're looking for addiction care or mental health care and to be able to reach those providers. And I don't know about you, but I've been a single mom before, and it's one of those things that if it's a choice between feeding my kids and putting food on the table or driving an hour each direction once a week or once a month, I'm going to choose my kids. And so we needed to find a solution for that. We're bringing comprehensive care. So one of the reasons why that we have this big of a unit is because there are 3 separate rooms in here, and we'll take everybody on a tour when we get done. This is a one-stop shop. So the part that we do is integrated care is that we offer comprehensive care. We offer solutions for what are complex problems. So you can come in here and get help with addiction help. You'll be able to see a mental health provider, and you'll be able to have peer recovery support services all in one place. You may need all of that, or you may need one part of that. But no matter what that is, or no matter what your community needs, we are here to offer and collaborate, right? We're not here to take over any areas. We're here to work with our community stakeholders, right? With our police departments, with our patients that are here, with other medical providers who might want to learn how to do this, but simply have been afraid to step into that area and unsure. We're going to have naloxone that's on board, and we brought some here today. So anybody that doesn't have naloxone, we will train you. You will get some free. We've had some wonderful donations that have occurred, because I'm a believer that naloxone should be in every single household in Arkansas. You cannot save a life if you do not have it available. So it's time that overdose, because naloxone is not available, should stop. And so if you're a school, if you're a business, if you're some other community stakeholder, or you're a parent who's scared to death about what's going on with your teenager, call us. We have training for free. We have naloxone for free. We want to totally reduce that in the state of Arkansas and be able to help be one of those providers that can solve that solution. Just real quickly, evidence-based medicine for us and medication-assisted treatment is about, we have medicines that are available that is not just naloxone, but we have other medicines that are available that can help stabilize people with opiate use disorder. We know that of all the forms of recovery, whether it's residential treatment, whether it's 12-step meetings, whether it's going to therapy or whatever, when you have a solution that integrates all of that, you have your greatest success rate. You'll have 85 to 95% of people who will be successful in recovery at 1 year whenever you use an integrated approach. So that's what this unit helps to bring. We want to be able to improve patient outcomes, build a foundation for long-term sustainable recovery. How many of you are business owners that are here that want to make sure that you have a workforce that can come to work? How many of you are just community stakeholders, people with the church, people who have interests that want to make sure that your neighbor is doing better? Or maybe you have a family member who has suffered the disease of addiction. When you walk in our doors or you call Armor, you will be talking to people that have no stigma, that have no judgment. We are here to provide solutions, and we appreciate the fact of y'all coming out today. We look forward to the partnerships and the ideas. We are open and willing to do whatever it takes to help save our communities and help save our Kansans. Thank you.
I wanted to take a moment and recognize Wade Carter, who is the Armor Program Director. Wade is a person in long-term recovery and has worked in the treatment and recovery field for quite some time, and it's an honor to have him on the team directing all of the efforts that this mobile clinic will engage in. And I wanted to also recognize, there's a team of people standing, thank you, Wade. There's a team of people standing back here, and this young man in the red shirt on the front row. This is part of the Second Baptist Church family. Second Baptist Church has been feeding individuals in Malvern with housing and food insecurity for many, many years. And Dr. Martin made connections with them through her work in the Malvern Emergency Department at Baptist. And when we approached Second Baptist Church and said, can we partner alongside the incredible work that you're doing, they immediately said yes. So every other Monday night, tonight is one of those nights, the Armor Mobile Health Clinic will be at the Tractor Supply Company in Malvern, right down the road, as this good team provides food for those who need it in the community. We're going to provide addiction medicine care and other resources for this community as well. Consistency is an important part of what's going to make the mobile health clinic successful. It's our commitment to Malvern to be here every other Monday. we may layer in some other visits. And I wanted to let you know that beginning tomorrow, on alternating Tuesdays, the mobile health clinic will be in either Morrilton or Danville in Judge Ramey's, that's the 15th Judicial District. Judge Ramey does some incredible work with Drug Treatment Court. We've been a partner of his for a long time. And we're going to announce other dates as we build those community relationships. But every community that Armor goes into, there's a lot of very meaningful and impactful work that's already being done. What Armor is going to do is come in and add a layer of specialized care on top of the incredible efforts that are already underway. No one understands that better than the Attorney General, Tim Griffin. When Dr. Martin approached him with this idea, he was very receptive. He asked some tough questions because that's his job. But he's a man that on a daily basis exhibits his commitment to the citizens of Arkansas. The fact that his office provide the funding to get this mobile health clinic off the ground is a testament to that. Mr. Attorney General Tim Griffin, thank you very much.
Thank y'all. I thought what I'd do, since we're spending your money, public money, for this, I thought I would explain a little bit about my perspective, the perspective I brought to the office of Attorney General when I was sworn in, because I knew before I was elected Attorney General, I knew that there would be money that could be spent, had to be spent if it was going to be spent on opioid abatement. So I knew this money was going to be there, and I thought a lot about how to spend it, because there are a lot of different paths that you could take on that, many of which would be legitimate, but they're very different. For example, you could say, well, I'm going to take all the funds we have and just buy Narcan. That's it. That's all we're going to do. We're going to spend all that on Narcan, which wouldn't be a bad thing, but there are other ways to look at it. So when I came into office, I had decided that I wanted to invest in infrastructure and not just what I call ephemeral items that a few years from now will be gone. That's important, and we're doing some of that. But I really wanted to make the core of our spending, wanted to let that focus on either brick and mortar, research, outpatient, inpatient, those sorts of things, so that we would be investing in something that 10, 20, 30, 40, 100 years from now will still be potentially having an impact, because this problem isn't going away. So I took that perspective to the office, and you've seen some of that manifested. We are certainly buying what I call the ephemeral things. We're buying Narcan. We're giving a little money here and a little money there to different groups who need help for this or that. We're doing that. But we're also investing in the long term. So you may have seen that I announced $50 million to establish the National Center for Opioid Research. That's a children's hospital project. And that's going to be a game changer for not only the state, but the country. And we've started to fund that. So that's an example of a long-term infrastructure investment that is solely focused on opioid abatement. So we're doing that. Another perspective that I brought to the office related to what I'd heard from constituents, and it also relates to the investment in infrastructure, the manifestation of which you see behind me. And that is, I had heard from people. I remember in particular a call from someone in Northeast Arkansas. On one occasion, a gentleman called me and he said, hey, I don't know, like everybody else, they have my cell phone. I didn't know the guy, but he said, hey, I just wanted to tell you that I have employees with addiction problems, opioid addiction problems, and we have a care access problem. I mean, there's really nowhere near where we're located to get the help that they need. And we started talking through it, and we talked about Little Rock, we talked about Jonesboro, some other things, and he said, look, the facilities we really need, we can't get to. And that was a relatively brief conversation, but it stuck in my mind that access is a part of this, right? And I've gotten a ton of requests that we're reviewing for inpatient, outpatient. Some of them involve building or at least filling brick and mortar and establishing immobile care for those with addiction. But, we've got 75 counties, and we've got a lot of communities where it's not a good use of $5 million or $10 million or whatever, because we don't have enough to go around. It's not a good use to build or try to build brick and mortar and have a big facility when there's not that many people there. Because I have to look at the state and look at where we impact the most lives at a time. And so one of the things that we thought about is how do you get the care to people in different places, in places that are beyond the reach of Little Rock and some others, and transportation is certainly an issue. And enter your idea in this amazing, what looks like an RV, but the whole Armor concept, where you can have this sort of facility that is here, you know when it's going to be here, you're scheduling it to be here, the hospital knows when you're going to be here, the city knows, the healthcare professionals know, and so in the Army we would say there's a certain battle rhythm to it being here. You're going to know the access that will be provided. And it can come other times, but you want some predictability, okay? And you've got that here. And now someone mentioned Danville and Morrilton. Well, that's not close. Try doing that with brick and mortar. Good luck. Not going to happen. So what you're seeing with just the mention of Malvern and those other two towns, Danville and Morrilton, you're seeing this mobile concept of we're going to come to you. We're going to come to you. You're seeing that at work. And that was what was envisioned. And I can't remember, Doctor, I think you asked for like 30 of these, and I'm kidding. She didn't ask for 30, but I think she was dreaming of more than one. And I think at some point I said, let's do one. Let's do one. Let's see how that works. Let's see if it's having the impact. Let's let metrics and outcomes and data tell us how this does, right? And the impact that it's having in the community. And because what we want to do with your money is we want to spend it wisely. Therefore, we want to find the outcomes that are good, that are meeting our expectations, and we want to invest more in those and replicate that. We were just, before we walked out here, we were in here talking, I guess continuing a conversation we had some time ago, which is just sort of when you're thinking aspirational, dreaming, how many of these would we need to geographically touch unserved or underserved parts of the state? That's something that's part of the conversation. And I certainly can't do all of that, but the office can't. But if we have a model that we know is working and that we know is being efficient and that we know is part of the treatment solution, in addition to prevention and awareness and all these other things, then that's an area we want to double down on. And that way I can go to you, the taxpayers, and say, this is why we did this, and these numbers demonstrate why we're doing more of it. because we can show you that it works. We can show the number of lives impacted. We can show you people who otherwise would not have access to treatment that has now been made possible because of this. And so this is an exciting day, but make no mistake, this is the beginning. Right now it's empty. What really matters is when it's got people in it. And people, because that's when you know people are getting help. But the fact that it exists telegraphs to people once they are aware, because not everybody runs to the help as soon as they know it's available. It's a thought process, right? Sometimes it takes a while to get there. But it's here, it exists. We're going to make that known in all these different communities, and we're going to communicate that if you fall into the I don't have transportation, I don't have time, I don't have childcare, whatever, we've got a way to meet you where you are and help you with the problems that you're dealing with. So I appreciate y'all being here. This is really important to demonstrate this, the possibility of this. And I am most excited, not just about its existence, but about what we're going to see it do, because it can be a model for the rest of the state. So thank y'all. Thank y'all for all that you're doing, Doctor, and everybody who's played a role. Thanks to the folks at Second Baptist. Feeding people is the ultimate demonstration of love, and it opens the pathway to other sorts of help, and it builds a trust. And I'm glad y'all are partnering, because I bet you're going to have some people who come see y'all who end up wanting to see y'all and deal with their stomach and deal with their addiction. So God bless y'all. Thank you for being here. I appreciate it.
Thank you, General Griffin. I wanted to recognize Mayor Weldon and Representative McClure, talking about people who believe in practical solutions for their community. Those are two individuals, and we're grateful to have you here today and to have your support. There's a table with Life Saving Naloxone on it over here, and there's some brochures that'll give you some more information about Armor. But if you don't have Narcan or Naloxone in your possession, Russell, Stacy, and Tahara will be at that table as soon as we're concluded. Please go over it. Take just a matter of moments to get trained, and you can leave with life-saving naloxone. But thank you. There's many other people here who have provided an enormous amount of support over the years to get Armor off the ground. We're grateful to each and every one of you. Dr. Martin and the staff will be available for questions. We're going to open the doors, and we want you to come in and have a tour. Again, General Griffin, thank you very much for your support. Thank y'all for being here.